Good evening, everybody. My name is Dr. Halasa. I'm the founder and author of Regenerative Medicine. My background, I did some pain management a couple of years, and then I developed this company called Regenerative Medicine, which is basically to explain alternative medicine, integrative medicine, regenerative medicine, and bring the chemistry and bring the mainstream doctors on the board to understand how those alternative medicine works. And the chemistry that we use is called redox medicine. It is it's just only 10 years. It's recent science, and we are translating it into clinical and helping the mainstream doctors to understand how those integrative, regenerative, photodynamic therapy works. So this is my team of doctors who are adapting the protocols that I designed and put together. And of course, it's very important when we develop any protocol that has to be follow the criteria of evidence-based medicine. And so what is evidence-based medicine is an approach to medical practice intended to optimize decision-making by emphasizing the use of evidence from well-designed and well-conducted research. So all the protocols, they have to be originated from published randomized controlled trials with same results. All the protocols that we propose, we have to know the mechanism of action, how it works, and what are the predictable side effects. We don't give things and say, well, it works, but we don't know how it works. That's not us. And that differentiates us from other alternative medicine doctors, integrative medicine doctors who lack understanding of the chemistry behind the therapies that we propose and we recommend. The other thing is that when we give any treatment, we have to monitor the treatment by reliable, accurate, objective diagnostic testing, not just saying, well, it works, but do you have any evidence? Well, the patient feels good. That's not, that's subjective. So we have to have an objective, reliable diagnostic testing that monitor the efficacy of the treatment. And all my protocols that I developed when I worked with Dr. Weber and now working with Dr. Luna, we would have diagnostic testing to objectively monitor the efficacy of our therapy, which will differentiate us from other integrative and regenerative medicine. I think this is very important because the mainstream doctors, they want to know how the therapy works. They want to know if there's any predictable side effects, any cross reactions. They want to know whether your therapy works and do you have any objective evidence. Do you have any tests that will monitor the efficacy of the treatment. So that's called evidence-based medicine. And all what I do is based on evidence-based medicine, and I'm using redox biochemistry to explain the mechanism. So Regenerative Medicine is a new medical specialty that focuses on developing diagnostic and therapeutic protocols to enhance stem cell therapy and manage oxidative stress-related diseases by modulating the nitroredox-sensitive epigenetics and biochemical pathways. So most of the chronic diseases out there, they share a common thing, which is an increase in the pathological free radicals. And so I can redefine all those chronic diseases, whether it is degenerative disease, or autoimmune disease, or chronic inflammation, or chronic infectious disease, or metabolic disease, and some genetic diseases. I can say the problem is in the metabolism of redox. It's a new field of medicine, yes, and I think that's the common denominator that's common among all those chronic diseases, and so we can redefine those chronic diseases as oxidative stress-related disease. To make it simple for you, oxidative stress or free radicals, pathological free radicals, is like exactly when the car rusts and gets old. The same thing that's happened to us as part of aging or part of the inflammation degeneration is rusting and oxidation and damaging of the tissue. But the mechanism is by oxidation. So if you have inflammatory disease or you have degenerative disease, or you have autoimmune disease, you would have pathological high free radicals that cause oxidation and damage to the tissue, and induction of apoptosis and killing the cells. Even cancer, we consider an oxidative stress-related disease. Chronic free radicals, like if you have chronic stress psychologically, or you have any inflammation, that site of inflammation can become cancer. So it is very important to prevent cancer, is to control the redox and normalize it back to normal. But how we can control the redox, how we can treat oxidative stress-related disease, how we can buffer the redox potential, is by using all those biologics, which are stem cells and PRP and exosomes, or using nutraceutical, thiols, nitric oxide donors, polyphenols, or we can use energy, photomedicine, electromedicine. Psychotherapy can help also to reduce the oxidative stress as well. And it's very important for the medical doctors to understand the difference between the pH and the redox potential. So pH, everybody knows it, it's acid and alkaline. A lot of doctors are confused, and they think that pH control, if you control the pH, you can treat cancer. So that's why they put you on alkaline diet. I'm against that theory because I believe the cancer behavior is controlled more by a redox potential. And if you say that pH it can have some impact on the cancer behavior, that's through the changing in the redox potential. So if you have acidosis, that can lead to increase the free radicals and increase the redox potential, and that's the reason you would have cancer, but it's not direct effect. So that's why most of the treatment of alkaline diet is not that effective to treat cancer, but modulating redox potential is the way to treat cancer. Even the mainstream drugs that we use, chemotherapy, radiotherapy, proton therapy, photodynamic therapy, how they work, they increase the free radicals in the cancer cells, and when you increase the free radicals, the redox potential high, it induces apoptosis and kill the cancer. So, in order for me to kill cancer, I will increase the free radical production inside the cancer cells and induce apoptosis and kill the cancer. But in order to help to treat inflammation or treat metabolic disease or autoimmune or degeneration, what I will do, I will try to lower or buffer the redox. Means that if it's high, pathological high, I will do all the therapies to lower it down. And how we do those therapies, as I said, nutraceutical, energy, photomedicine, electromedicine, all those energy medicine helps to restore the redox potential. Biologics, stem cells, exosomes as well, they can do that. So it's very important that we know the difference between redox potential and hydrogen potential, the pH. We know the range of the pH in the body, how much it is, 7.35 to 7.45, right? And your body maintains that, right? And if any drifting happened in your pH, what would happen? You would have acidosis and alkalosis, and you would have an acute condition, and you end up in the ER, and they have to fix the pH, right? So most of the pH changes leads to acute conditions, which can lead to cardiac arrest, convulsion, confusion, right, and death. So it's an emergency situation that needs to be fixed when you have acidosis or alkalosis. While redox potential, if it's been changed abnormal, then you would have chronic disease. All this degenerative disease, autoimmune, chronic inflammation is called due to, or part of the pathology is due to normal redox metabolism. And so what's the difference between the pH and the redox potential? pH, as a definition, is the tendency of a substance to attract hydrogen, proton. While redox potential is the tendency of a substance to attract electrons. And the pH in the blood is 7.34 to 7.35. The redox potential in the cells, it ranges from minus 400 millivolts into minus 170, because if it goes above that, then the cell will die. So that's the difference between redox potential and hydrogen potential. What I'm bringing to the table is understanding that redox potential controls most of the physiological process of your body. It controls the cell cycle. The cell divides based on your redox potential. It controls the cardiac rhythm, the circadian rhythm, the ANS balance, the brain plasticity, the insulin sensitivity, vascular endothelial function, immune system. So many of your physiology of the body is controlled by redox-sensitive epigenetics and physiology and biochemistry. And any abnormal in this redox potential or abnormal in redox-sensitive metabolism can lead to chronic conditions, oxidative stress-related diseases. We call them either degenerative disease, autoimmune, chronic inflammatory disease, and even cancer. So this is very important concept. And based on this concept, we can understand how alternative medicine work, how integrative medicine work, and how regenerative medicine work. Tell me if it's time. And so it's very important. Before, when we were in the medical school, we have something that's called the cell cycle, the G0, the G1, the S. Remember that? And it's controlled by phosphatase and kinase, and it's very complex. Now, recently, we find out the simple way of understanding the cell cycle and what controls it is actually redox potential. So the normal cell, we find out that the redox potential of normal cells, they measure the millivolt is minus 400 to minus 300 millivolt. That's normal cells, that's not dividing. But if I want to make that cell divide, especially if you have stem cells, then I have to increase the redox potential up to above 240 millivolt. And that you can do it with phototherapy, laser, right? Helps to stimulate the stem cells to divide because it will increase the redox potential up to 240. And that's where the cell, they start dividing because we have redox sensitive epigenetics. They feel that, and the redox potential is high due to the light is exciting the electrons and increasing the free radicals, physiological free radicals. So I'm not talking about pathological ones. And that will stimulate the cells to divide. When it gets into 220, the cell feels that they have sensitive epigenetics and they stop dividing. That's called the quiescent phase. And then when it goes above 200, the cell differentiate. And if it goes above 170, it will induce apoptosis. And if it goes above 150, then we will have necrosis. And that's what we do when we're treating cancer. We're increasing the free radical very high in those cancer cells to induce apoptosis and cell death. So now we understand that cell cycle is controlled by redox potential. And if I want to treat cancer or any disease that leads to abnormal death of cells like degenerative disease or autoimmune or whatever, I will buffer the redox and turn it back to normal if it's time. Okay. So now we know the photodynamic therapy works by increasing the free radicals in the cancer cells and inducing apoptosis by increasing the redox potential above 170 millivolt. And we know that the photomedicine, called regenerative medicine, works by increasing the physiological level of the redox potential up to 240, from minus 300 to minus 240, and that will stimulate the cells to divide. That's why when we do stem cells, we do laser. And this new field is called photoregenerative medicine. Right? So I published articles in 2016 at Harvard Medical School with Dr. Michael Hamlin, and then Dr. Weber adapted the whole protocol along with US doctors. And in this field, I call it photoregenerative medicine. It's a new field. There's not much of doctors in the United States that are doing laser with stem cells. We are a few doctors, but we are growing and we are expanding and teaching other doctors the importance of laser in stimulating stem cells. And the photodynamic therapy is you use photosensitizers, you inject into the body, they concentrate the cancer, and then you radiate with light, which increase the free radicals in the cancer cells very high, and it will induce apoptosis. This field of medicine is called photodynamic therapy. Okay, so how we can, let's say, for example, we have inflammation, we have degenerative disease, we have Alzheimer's, we have ALS, myotrophic atherosclerosis, or we have Parkinson disease, all degenerative diseases, and they all have high pathological free radicals. So how we can treat them? we need to buffer them. We need to lower those free radicals, and one way of doing it is photomedicine, right? Light therapy can buffer the free radicals and turn it back to normal. So I'll go ahead and show you some animation just to show the whole chemistry behind buffering the redox. And let's say I will show you some animation here. So if you have a patient with Parkinson disease, or a patient has Alzheimer's disease, they have inflammation, right? And when you put light in their brain, right, whether transcranial or intranasal, what will happen? They will release the nitric oxide from the cytochrome oxidase. They will also excite electrons, but those electrons that's being excited is not going to be picked up by the oxygen, it will be picked up by the NAD and turned into NADH, which is reduction, shifting the whole reduction to reduction and buffer the redox, and then the NADH will reduce the glutathione, and that helps to suppress the pathological free radicals and normalize it, which decreases the degeneration process. So that's the mechanism of photomedicine. And so we will have shifting of the redox into reduction. If I go back to, if I have a healthy tissue, right, or stem cells, we find it's different. When yes, the light helps to increase the nitric oxide, which is good, and that will vasodilate, increase the blood flow, especially when you inject those stem cells into the joints. You need that for the stem cells to survive. You need that blood flow. And nitric oxide also stimulates stem cells and mitochondrial biogenesis. But also, those light excites electrons, but the electrons here who's going to be accepting it is the oxygen, and that will lead to shifting to oxidation, not pathological oxidation, physiological oxidation. That will increase the redox potential up to above 240 minus 20 volt, which help to stimulate the cells to divide and differentiate. So that's the mechanism of actually shifting here to physiological oxidation that you needed to stimulate your healthy cells to differentiate and divide. So the light, in general, it buffers the redox. If it's high, it drops it. If it's low, it brings it up. 5 minutes, okay. So this is the mechanism, is how we talk to the mainstream doctors, and they want to know how light works. So we bring them all the chemistry, because if you tell them that, it just works, it decreases the nitric oxide, those mainstream, okay, so it decreases the nitric oxide, what nitric oxide does. Nitric oxide itself is anti-inflammatory, it blocks a COX enzyme like aspirin. So you need to explain how the light works for the mainstream, because they understand aspirin works because it blocks the COX enzyme, the cyclooxygenase, and the light also works because it increases the nitric oxide. Nitric oxide works like aspirin, it blocks the COX enzyme. And then you know that it excites electrons and it buffers the redox. If it's low, it brings it up. If it's high, it brings it down. And you show them all the mechanism, and then they will be convinced, and they will say, okay, great, now we can do the photomedicine. But if we just say it works and we don't know how it works, nobody will accept it, and the mainstream will reject it. What about the blue light? Blue light works through the hemoglobin. They release a nitric oxide from the heme, and the nitric oxide reacts with the free radicals, become peroxynitrate, and then the hemoglobin contains thiols called peroxyuroxin. They will turn the peroxynitrate back to the nitric oxide. So generally what we're doing, I'm scavenging and getting rid from the free radicals, and I'm shifting the redox into reduction. And if you do that, you decrease the inflammation. So that's one process. 2 minutes, 1 minute, 3 minutes. This is the, okay, so I think I will have another half an hour and I will do the photodynamic therapy because, so if you have any questions? Any questions? We do the photodynamic in the next session because it's a different thing. And I want you to process those information. So if you have any question, anything for what we learned, Dr. Fred, do you have any question?
No, very clear to me, but I'm not sure that everybody else followed it.
Yeah, I'm trying to break it down to the public, but at the same time, you don't want to lose the scientific concept of it. So that's the difficulty of science.
Dr. Rasa, thank you very much. Picking up what's got a huge praise to Dr. Rasa,
So yeah, sorry, I was just going to ask, if, because the cancer that I've got, is that almost as if saying that my body was incapable of buffering the redox, is my body then struggling to buffer certain aspects of it?
Okay, so you mean what caused your cancer? Yes.
Like, to be sure.
So most of the cancer there's genetic errors. So it is something genetically, it's not your fault, it's genetic. And I think with new generations, those genetic errors will increase. So we'll be expecting cancer will increase. So that's my theory about the cause. But also environmental factors can be part of it, a combination of genetic and environmental exposure to chemicals and the global warming and all this ozone, the ozone hole of the universe. All of this thing can be a factor for the environmental, but the base you have some genetic errors. That leads to abnormal redox metabolism as the beginning, but there will be specific pathophysiology as well. And that can lead to altering your genetics, and when you alter the genetics and mutate, they end up dividing uncontrollable. So hopefully that with photodynamic therapy, we'll be able to eliminate what's being left from the therapies that you have done.
So that could actually alter the genetics if I was to pass on?
No, we're not going to alter the genetics, but we will try to destroy any cancer cell that's left there when we give you methylene blue possibly and ICG, curcumin, that may help to remove all those cancer cells that's being left. But curcumin is good to have it all the time because it helps to buffer it helps to kill cancer stem cells and increases sensitivity to cancer cells to the free radicals, so it will induce apoptosis. So when these cancer cells become wild, your curcumin helps to increase the sensitivity to the free radicals, so they will die before they will proliferate and grow. So curcumin helps you to prevent you from any emerging of your cancer stem cells. So that's what I would do. Any other questions? Okay, great, beautiful. I'll see you another session. They have another 30 minutes. We're talking about photodynamic therapy. Okay, so here we have patients, and I did not cover the photodynamic therapy, but when we cover it, I will be talking more about what the patients are doing. But now we are giving them ICG, and we're giving them curcumin, and they will concentrate into the cancer. And then we radiate it with light and help to increase the free radical and induce apoptosis and kill those cancers. So that's the mechanism, and that's the methodology we do. This patient also, she has Helicobacter pylori, bacteria in her gut. We think that the curcumin will help to, as an antibiotic, to help to kill it. But we'll also, again, I also recommend mainstream medicine as well. So she's got to take triple antibiotics. Or triple therapy, we call them, for these patients, which is it's anti-acid and 2 antibiotics, and then we will maintain the effect using alternative therapy, which is oral curcumin for the patients, and who has Helicobacter pylori. Hopefully, she will be completely in remission or cured from Helicobacter. But for other patients who have cancer. This is the therapy that needs to be done. Again, this therapy needs to be continuation. So the short treatment is not going to be as effective. And for the dynamic therapy, we need at least minimum of 3 months, 6 months, even 1 year. It needs to be continued. So it's not enough to do 1 week and 2 weeks and say, hey, I'm done. but we'll try to make it affordable, hopefully, when we manufacture all those drugs in South Africa. And we're going to discuss that when I come back. Thank you. Thank you very much.